You've got questions, we've got answers. Welcome to the Therapist Question Box, where trauma-trained therapists tackle real questions from real people. I'm your host, Lindsay and bringing you grounded insights you can actually use, brought to you by Therapy Utah. Another episode of the Therapist Question Box. We are here to answer your mental health questions, your relationship questions, and anything in between. So get on our website and ask away. Today I have with me Dr. Brian Chandler. Brian, thanks for being here.
Thank you for having me.
Happy to have you here. Brian has been at Therapy Utah for how long?
Oh gosh, going on, this is seven years. Yeah,
okay.
February of 2019, I think.
You're an old timer.
Yeah.
I love it. That's awesome. So we're going to talk to Brian. I want Brian, first of all, to introduce himself. So tell us a little bit about you.
Born and raised in Boston, Massachusetts, schooled in Utah at BYU, and then Kansas State. I did marriage and family therapy, and then in Pennsylvania is where I got my Doctor of Psychology degree, and then eventually landed in Missouri, southern Missouri, Springfield, Missouri, where I had a practice for 22 years, doing a lot of different things, a lot of individual and family therapy, worked a lot with kids, did a lot of psychological assessment, which has kind of become my bread and butter. I came back out to Utah almost 8 years ago, and I've been working with the Department of Corrections for the last almost 8 years. Primarily conducting comprehensive psychological evaluations up at the state prison.
Okay.
And so
how is that?
It's fascinating.
Yeah,
it's
I would
fascinating.
imagine.
We have interns at all levels, and we have doctoral interns, and they come and they work with me on these evaluations, and they just say, "This is so fascinating." And they compare it to some of their work in the community. They say, that's kind of boring out there.
Yeah.
But here, this is so fascinating.
I would imagine. Yeah, I would imagine it's fascinating.
Yeah.
That's very cool. And how long have you been there?
This will 8 years this summer.
Okay.
Yeah.
Doing psychological evaluations.
Yeah.
Nice. That's great.
Yeah.
Very cool. Well, we're going to talk about psychological evaluations. This is a listener question around a psychological evaluation. So we'll go ahead and jump in.
Correct.
Here's the question. I've been in therapy for a while and it's helpful, but I still feel like something bigger might be going on. My therapist mentioned possibly getting a psychological evaluation. And honestly, it sounds kind of intimidating. How do you know when it's time for a psychological evaluation? And isn't it only for serious mental illness? So let's answer that very last part of the question first. Is a psychological evaluation only for serious mental illness?
Absolutely not. Yeah. The human organism is very complex, and the human mind is very complex. And so people that have serious psychiatric disorders, they can certainly benefit from a psychological evaluation to better understand. But so many of us have all kinds of things going on in life that can cause distress. A lot of times there's patterns of behavior that have developed over years that are dysfunctional. There's personality styles that have developed that maybe could be addressed. Depression, anxiety, that's all kinds of things. And a psychological evaluation really helps us take a deep dive into what might be going on. And we just have, as psychologists, we have so many assessment tools at our disposal that we can use to really help understand a person.
So what can a person, it's helpful to hear you say that. It's not just for serious mental illness. It's really, we're complex mechanisms. Our brain is a complex organism. So we've got to try to figure it out, right? Mm-hmm. So what can a person expect when, this listener is saying, it sounds intimidating? I would imagine there's a lot of people that feel that same way, that it sounds intimidating. Would you agree with that?
I think, I do hear that.
Yeah.
But it's not. One of the things I tell people right away when they come into my office, I say, you don't have to be nervous. This is not anything to be afraid of. Some of this is kind of fun because I think it is. Some of the tests I do are kind of fun. They're interesting. Or some of the cognitive tests we do, manipulating blocks to make designs, I think it's kind of fun. And then a lot of the tests they do, they're answering questions, simple questions, true, false questions, just to understand their personality style. And so nothing to be afraid of. And it's not like I'm, getting in and, I think sometimes they think I'm doing some hocus pocus and brainwashing or getting into their head. And I'm just trying to understand them better and to inform them as to how they can move forward and be more successful.
Yeah. Isn't
Yeah.
that the truth? Like, this is not about finding deficits
Right.
and finding what's wrong, but really saying, here's what I think might be going on, and
Yeah.
here's how you can move forward in a healthy way.
That's it.
So what can a person expect going into a psychological evaluation? Like, let's just start with nuts and bolts. How long are they, like time-wise?
I usually block off 4 to 5 hours.
Okay.
And so, yeah, and a good portion of that up front is just gathering a lot of background information, do a very thorough clinical interview, getting background history on your early development, family dynamics, education, extracurricular activities, hobbies, any substance use history, mental health history, as a child, medical history, understanding what's going on medically, work history, all these different things are all important to kind of start to create a picture of an individual's life,
Yeah.
and then start to gather the symptoms that they're experiencing, so I can understand what some of the presenting issues are, and then we start to get into the tests, and it's standard to do cognitive testing, which includes two parts. IQ testing, intellectual assessment, which is, I tell them, it's pretty much genetically predetermined within a window. It's not something we can take the dictionary and start to memorize words and really improve within that window. We're gonna be in that particular range, and so, but to understand someone's intellectual functioning, and then their achievement. The achievement testing is how well have they acquired fundamental academic skills like reading, spelling, math, and so forth. And then we like to look at those, compare the two, because sometimes someone has a high intellect, but their achievement is not consistent with that high intellect, which is diagnostic. There may be a learning disorder. There may be other reasons someone has not been efficient in applying their intellectual skills. It could be trauma is a big one, or severe psychopathology. Lots of things can come into play. ADHD, something like that, can be a reason for that. But that's a piece. So the cognitive piece is the first part I often start with.
So does the cognitive piece, the information from that, then inform where you go next? Is that right?
Not completely. It's pretty standard.
Okay.
If I do start to see some things in the cognitive testing, I can certainly tailor what I do next to meet the specific needs of the assessment. But regardless of that, I'm going to do some personality testing or testing for psychopathology. That's a big word. Sounds scary.
Tell our listeners, what is psychopathology?
Yeah,
How would you define that?
It's just, think about psyche, which is the mind, and pathology, which is an illness or disorder, and so any kind of disorders of the mind. And that there's such a wide range.
Sure.
I don't like the term mental illness, which we use all the time, and because mental illness, it really, to me, sounds severe. It sounds more like the severe psychiatric disorder that the question addressed. But because anxiety, depression, these technically are mental illnesses. They fall into our Diagnostic and Statistical Manual of Psychiatric Disorders, and so they are mental illnesses. But I like to just call them, again, emotional disorders, often the term I use, with the run-of-the-mill depression and anxiety. And so, so psychopathology, we're just trying to assess if there's anything amiss in the person's emotion, thinking, behavior patterns. That's what we're looking for.
Okay, that makes a lot of sense.
Yeah.
So what are some signs that a person might benefit from coming and getting a psychological evaluation? When do they know?
I think the question that you asked at the start is probably a good one, because if you've been in therapy, you're working on some issues, and you're still not finding relief or answers or feeling that you've improved much, then certainly a psychological evaluation would be a good thing. It can help take a deeper dive to figure out what might be going on. Again, lots of assessment tools we can use to really help understand what's going on with an individual.
Yeah.
So that would be certainly at one time. A lot of times, I don't do as many of these educational evaluations, but In the past, I did more some children and adolescents that are struggling academically. That's a great time to come in and do an evaluation to really zero in on the cognitive piece. And there's lots of different assessment tools that can be used there to understand. Court-ordered evaluations. I do a lot of that. I work full-time at the prison. And then even in this outpatient practice, I do a lot of court-ordered evaluations. Somebody gets in trouble for breaking the law. A lot of times the court wants to understand what's going on here. Is this a bad apple or what? What happened here?
Sure.
What's this person thinking? And so, attorneys will call me and ask if I could do an evaluation, understand what's going on with this person and how can we help them be successful. And so that's a big part of what I do. Happy to do that, and I enjoy doing that. It's fascinating to me, to understanding people every day at the prison, evaluating some of the inmates, and again, trying to really understand what makes them tick. Why did they do what they did? Whether they do what they did, and then what the Utah Board of Pardons and Parole wants to know from me is, are they at risk of doing this again? And what do they need? How can we help them so that they don't do this again?
Man, no pressure on that. Our public safety rests in your hands, Dr. Chandler.
That's right.
Yeah, wow.
And I work primarily with the sex offense treatment program, so we're doing comprehensive psychosexual evaluations.
Okay.
So this is a psychological evaluation with an additional piece.
Okay.
There's assessment tools we use to assess risk of recidivism for sex offense and sexual interest patterns, and so sexual deviance. And so we have lots of instruments that we use for that. But so for me, it's fascinating to understand and to really try to help these individuals understand themselves, why they did what they did. A lot of times it does go back into early experiences and things that have happened in their life and patterns that have developed and thinking patterns and behavior patterns. And so to really help them and then make recommendations for treatment so they can move forward and be successful.
Yeah. So that's my next question is, okay, once we get the psychological evaluation done, it happens, then what?
So I'll take all the material, all the test results, score the test, get the results, interpret those results, write up a comprehensive report, and then have the individual come back, usually in 2 to 3 weeks, and go over all the test results, explain what they mean, the cognitive tests, the IQ, the achievement tests. I'll take out all the personality tests, look at personality style, any signs of psychopathology, point out the elevations in different areas, if they're elevated in depression, anxiety, if they're elevated in PTSD, all the different scales that we have, if they're elevated in a schizophrenia scale. Doesn't mean they have schizophrenia, or bipolar scale. Doesn't mean they have bipolar disorder, but these are scales that say they've endorsed some items that suggest they have some symptoms that are similar to people that have these disorders, and so we want to look at that. And it could mean that there is a more serious psychological disorder.
So are you diagnosing when you are diagnosing?
So then I make a diagnosis.
Okay.
Yes, I make a diagnosis and give a lot of recommendations for them moving forward.
So recommendations, give me some example of what your recommendations might look like. So is it therapy always? Is it behavioral recommendations?
Yes.
All the above?
All the above. Yeah, a lot of times therapy, certainly. And I would say of the people I evaluate, probably 3/4 of them have some anxiety or some depression.
Yeah.
It just seems so prevalent.
Yep.
And a lot of times people are coming to me because they're struggling with anxiety and depression. They really want to figure out what's going on and how can they overcome this. And so that's a big part of it. And so, therapy certainly is so important. I recommend that frequently. I do talk about patterns of behavior and thinking patterns that they can work on themselves in addition to therapy, kind of supplemental work that I think is so important. Is certainly as I've seen patients over the years and worked with those that have struggled with depression, anxiety. I give them exercises. I talk about emotional fitness. That's a whole nother podcast. This idea that there's things that they need to be doing. You can't just come to therapy once a week or twice a month and think that my therapist is going to cure me.
That's right.
Yeah, you've got to go out and start to take what you learned in therapy, start to apply it every day, and start to change some of the patterns of thinking, and then start to change some of the patterns of behavior. And so yeah, I do a lot of that in my recommendations. I often recommend, medication. Mixed feelings about medication. I don't want to offend anybody. I think we often go there too quickly. It's just my own maybe bias, because we often think, well, this is a disorder of the brain. It's organic, and it's something that chemistry needs to fix. Certainly, the brain. I feel the brain is involved. There's no question, but I talk about the neuroplasticity of the brain and how it evolves, and how
tell our listeners what that means.
The brain is very malleable, and neuroplasticity means that this organism it's changing. This organ is actually changing and evolving based on your life experiences, how you think and how you interact. And for example, cab drivers in London, they have to take this really difficult test. It's actually called the knowledge. And so
the test is called the knowledge.
The knowledge, yeah.
That is interesting.
It really is. And the test, apparently they have to know all the streets and all the landmarks of London, big city. And they've done brain scans of cab drivers in London, and the part of the brain that deals with spatial relations is like really well developed, extremely well developed, more so than most people, because they've developed it like a muscle.
Wow.
Yeah. I use the example, if a child, hopefully this doesn't happen, but unfortunately it probably does in orphanages, raised in kind of dark and isolated, secluded area, the brain would prune the synapses that deal with probably with vision, and probably enhance the synapses that deal with touch and hearing. And so the brain is a fascinating thing.
It adapts.
And people, they do brain scans of people that are depressed and have anxiety. And what happens? Well, the centers that deal with depression and anxiety are lit up like a Christmas tree. And so people then mistakenly say, well, look, the brain's the problem. And I would say, whoa, slow down. This is a snapshot in time. This is today. Was it that way 3, 5, 10 years ago? Probably not. Does it have to be that way 3, 5, 10 years hence? Probably not. You can do things that will rewire the brain.
I love that reminder that we can do things to rewire the brain, because I think sometimes we feel like, nope, this is the way I am. This is the way I always will be. So why even try?
Right.
But neuroplasticity says otherwise, that we are adaptable. And
Definitely.
that's where I believe that gives so much hope too.
Yes.
That, if you're suffering with this, it is real and it's valid, and it doesn't have to be forever.
That's right.
Right. So I love that reminder.
Yep.
So that's really helpful. Those are some reasons why people might benefit, and then what you do after. Any other thoughts on why it feels why people might hesitate to get an evaluation done?
Why might they hesitate? Maybe they're afraid of the results.
I think that's a big one, actually.
Yeah. I mean, people that, what's this crazy lump I have? Oh, no, it's cancer. Oh, I don't want to go see the doctor because it's going to be cancer. Something. People, just different. I think of my father-in-law. He hated going to the dentist, and yet if we just do the basic, maintenance, it does us well. And so this can be a maintenance thing. Let's get you, emotionally healthy. Let's understand what's going on. Don't be afraid of the results. Pushing it aside, ignoring it's not going to make it get any better.
That's right. And ignoring it doesn't make it go away, right? When you said that, I think that's such a good point, that it's scary. The results of it are scary, because then we have to look at it we have to look at it for real. We can't just go, okay, this is a problem, but we have to really look at it and say, okay, now what am I going to do with this information? And however, what I will say is, when clients are willing to do that, then it also can become really empowering. Say, you know what? Actually, it makes sense. It makes sense why I've been struggling in this way. And it makes sense why there's this deficit, instead of I'm broken and I don't know what's wrong. It's like now there's a roadmap and a guide to say, this is what's going on, and here's what we can do about it.
That's right.
So it actually can feel quite the opposite and really empowering.
Yes. There's an explanation here.
Yes.
There's a way things that we can learn that will help us understand why, and then understand how to move forward.
That's right. And that's empowerment, right?
Yes.
Why and how to move forward. That's what we want. So
that's right.
Brian, is there anything else that comes to your mind as we're talking about psychological evaluations that our listeners may not be familiar with, or that you'd like our listeners to know?
Yes, a couple things. Just even starting with the difference between a psychiatrist and a psychologist, a lot of people misunderstand that.
Yes, tell us about that, because there's a big one.
Yeah, so a psychiatrist actually goes to medical school like any other doctor, and when they finish medical school, then they go on to their residency. So if I'm going to be a pediatrician, I can do my 4 years of medical school, then I do a 3-year pediatric residency.
Mm-hmm.
So psychiatrists, then they go on and do a psychiatric residency. They learn all about mental health, and they learn a lot about pharmacology and how to address emotional disorders and mental illness with medication. And so, and that certainly is an important piece. Psychologists, myself, I go to school, I get a PhD, or in my case, a PsyD, a Doctor of Psychology, and I've taken classes on therapy, as well as psychopathology and all the different assessment, psychometrics and assessment instruments that we use. And that helps me, trains me to be able to assess, evaluate, and then even make treatment recommendations and treat individuals with different psychopathological disorders. So very different. Two professions that really dovetail and work together to treat those with mental health issues. But the psychiatrist is primarily suited to address these disorders with medication. The psychologist is the one who assesses, does a really comprehensive assessment, and then can treat or at least make recommendations for treatment like therapy or maybe medication as well. And the psychiatrists, so the difference between a psychiatric and a psychological evaluation, because a lot of people think, I need a psychiatric evaluation. That's more, I don't know, I'm trying to say more informative. And I would say, no, not necessarily. The psychiatrist is not trained in psychometrics and the assessment tools that psychologists use. They are trained much more in the human body, the physical aspects of the human body and physical disorders. So that's very important. And the pharmacology, that's their training. But they're not going to do a lot of tests with you. They don't use psychological tests, the cognitive tests or the psychopathology and personality tests.
That makes sense.
Yeah.
How many times have you been referred to as a psychiatrist?
Many times. Yeah, many times.
And I would say my brother-in-law is a psychiatrist, and I think he's been referred to as a psychologist so many times, right?
Yes.
It's the same thing. They're really close, but very different,
That's right.
But I would imagine that you really work in conjunction with one another,
that's
right? And support one another.
That's right.
In your,
because in my recommendations, I would often recommend need to have a medical evaluation, see a psychiatrist to determine if medication would be useful here.
Yeah, that makes a lot of sense.
Yeah.
Good.
The other part of that is too, as a psychologist, a lot of times people think I want a neuropsychological evaluation because they think that's like the deluxe version of a psychological.
Interesting.
But that's a whole different animal. Yes, psychologists do that, but these are psychologists that are trained specifically with neuropsychology. They've really worked on the assessment more so than anything else. In fact, they probably just do that exclusively. They probably haven't done any therapy. They really are trained to understand the brain and how it functions and organic disorders. And so they're going to use assessment instruments that are different generally than what just a general run-of-the-mill psychological evaluation would use.
That makes sense.
And so it's not a deluxe. You would have it if there's some things, for example, if someone had a traumatic brain injury and you're trying to figure out, okay, what's going on now with the different lobes of the brain and how is this person operating now? You might do it if there's some strong indication of something organic going on. Or some severe memory deficits or dementia, signs of dementia, or those kinds of things that it really points to the brain. Something is going wrong with the brain.
Okay.
And so the difference between those two is important.
Yeah, I appreciate that understanding that it's not the deluxe model. It's actually
just
something different.
That's right.
Good. That's really helpful, and also just helpful to understand. I think it's something that we've heard. I think a lot of people have heard, but are not quite sure, like what is it and why is it necessary and when. And that's all these things are so helpful to really know when it would be beneficial to have. So any other thing that is that we have left? Is there any question that I haven't asked that feels important?
I can't think of anything. The one thing that seems to turn up a lot nowadays, autistic spectrum disorder seems to be a big thing. And so I haven't chosen to specialize in that. A lot of people, this office staff will say, hey, this person wants to evaluate their child or even an adult for autism, because it's become so much more talked about and we're getting more educated. Whereas in the past, it was 1 in 1,000, then 1 in 500, then 1 in 100, then 1 in 50, 1 in 40. Now I think we're down to like 1 in about 36 people are on the spectrum. And so that's a big thing. That one, I don't specifically do those evaluations. I have some screeners I can use, but the autism diagnostic observation schedule, the ADOS, is the gold standard for an autism evaluation. And so I always tell people you ought to go to someone that's trained and regularly works with those who have autism or assesses autistic spectrum disorders and treats them. And so,
well, thank you, Dr. Chandler, for all of your advice. That was so beneficial to learn more about psychological evaluations and to understand really they're not scary. In fact, you said they actually are fun. So with that endorsement and understanding also what the need is and how it can help us have a real roadmap to what's going on in our life and a path forward, really appreciate the insights. And if you found this helpful for you or another family member or a friend that you care about, please share it with them. This information can be really valuable and can change lives. So we hope this was something that you are listening to and really thinking, oh, okay, is there someone in my life where they could benefit from this? And if so, please share it with them and like and subscribe. And thank you for listening. And until next time, take care. That's a wrap for today on the Therapist Question Box. I'm Lindsay Schiss. Thanks for listening. And remember, every question you ask is an opportunity to learn and grow. Brought to you by Therapy Utah.
Hey, this is Kathy Kinghorn. I'm an owner at Therapy Utah. If you'd like to book with one of our trauma-trained therapists, go to www.therapyutah.org. Thanks for listening.